Hi, my name is Shannon Vogt. I am the Family and Community Medicine Clerkship Director for the University of Kentucky, and I'm presenting to you today on how to write narrative comments on medical student evaluations. So our objectives today are to review some common pitfalls in narrative comments, and we want to learn how to write narrative comments that are based on directly observed behaviors that are specific, objective, non-judgmental, and respectful, comments that are valuable and actionable, and comments that have been discussed directly with the student. We also want to avoid bias in our comments by using agentic language, which we'll discuss, as well as competencies. And other best practices are how to take notes so you remember the comments that you want to make, knowing the expectations of the student based on their experience level, and building off of mid-clerkship feedback. These are my sources. So this presentation was inspired by an STFM Medical Student Education Conference presentation on helping community preceptors better their narrative feedback. And I've also looked at some different research articles on medical student narrative feedback comments. So most medical students now are getting to be pass-fail, so the comments that you write on a student's evaluation are more important than ever. These comments are read very carefully by residency programs when they're looking at ranking students. So your comments really can be a big difference for that student matching or not matching or getting into the residency of their choice or not. So it's really important that we give students accurate comments, but also ones that are going to help them in their journey, or at least help them get to the right place. At UK, we have a UK, our MSPE letter, which is the letter that goes to all residencies. Our policy is that this letter includes comments verbatim from the top box of that final student evaluation. So as you see here, this evaluation has a box here where it tells you these will be included verbatim, and it has some comments about this student. And then there's a box below where it gives you the option of writing some things that you want to tell the student and make them aware, but it's not going to go in their MSPE. So for here, there was a little more explanation of things that they could work on. Now that could go in the main box too, and we'll talk about that, but just be aware we have those two box options. Some medical schools actually take all the comments and the clerkship director creates kind of the final comments, but at UK we do not do that. So although we review your comments for errors or bias or inappropriate things that we take out, for the most part, what you say verbatim goes into their letter. So what are some pitfalls of narrative comments? The most common issue that I see is vague positivity. This was a great student. They liked seeing patients. They're friendly. They did a good job. Wonderful student. Just kind of these vague things that are nice, but they don't really tell you anything about that student. And it's really hard as the reviewer to be able to tell, is the student really nice or are you just really nice? So even though we love hearing that we're nice and we're great, we really want to be more specific and not just vague. So being positive is okay, but it's the vagueness, and we'll talk about how to improve that. Another thing that we see quite a bit are what we call pink flags. So a red flag would be like the student is unprofessional. I mean, that would be a red flag for any residency program. They wouldn't want to rank that student. But pink flags are things that kind of make you go, what do they mean here? So the student improved over the course of the rotation. So do you mean that they were really bad and they got a little bit better? Or what do you mean by that? They responded well to feedback. Okay, so you gave them feedback and they nodded their head and didn't get defensive. I mean, that's fine, but I'd rather hear that they, had things to add to their feedback and asked for feedback. They were eager to learn. Did they not know anything and that's why they were eager to learn? So you kind of have these pink flags that you start to make assumptions about the student, right or wrong, based on how they sound. Other pitfalls in narrative comments are bias. So we're going to look at a couple of studies here, but this is kind of an older study from 2014 where they looked at 6,000 MSPE letters submitted to Yale, and they looked at all the words and they evaluated all the words in these letters. And what they found was that white applicants were more likely to be described using kind of standout words or ability words, such as like wonderful or hardworking, whereas black applicants were more likely to be described as competent, kind of words or words similar to competent. They also found that women applicants were more frequently described as caring, compassionate, empathetic, bright, and organized. Another study a little more recently from 2021 looked at 277 students evaluated at one internal medicine clerkship over the course of a year, and they found that women generally received higher scores in 5 of the clinical domains, which were patient interaction, growth mindset, communication, compassion, and that should be professionalism. And they also noted that evaluators were more likely to use a male student's name in the evaluation than a female student's name, whatever that means. They just noticed that difference. And women were more likely to be described using what we'll call compassion and compassion words, such as helpful, eager, team, whereas men's evaluations intended to include more agentic words, such as clinical, notes, rounds, demonstrated, skills, improve. So those are our common pitfalls. So how do we write good narrative comments on our evaluation? So the first thing is that we want to write narrative comments that are based on directly observed behaviors. So you've worked with the student all month, you've done a direct observation, you've watched them present, you've watched them talk to patients, you've seen how they've interacted with your staff. You have a lot you can pull from, and we want to put some of those examples in here. So here's a comment. Student Dr. Hughes will be an exceptional physician. Very kind. Exceptional is fine, but we need some directly observed behaviors. So how can we make this better? Student Dr. Hughes will be an exceptional physician because, and that's the important clause, of her willingness to ask questions, read independently, and request feedback on her performance. So if you're typing out, this is a great student, type because, and then try to think of why. What made that a great student to you? What exactly did they do that really stood out from maybe a student who wasn't so great? John performed well during this rotation. Pretty blah. John performed a thorough physical exam for a patient presenting with back pain, identifying some concerning findings that led to an appropriate workup. Good job, John. We also want to write narrative comments that are specific, objective, and respectful. So where we come into problems with this is when we have some more subjective comments on personality, maybe things that are less objective, or even just not being very respectful to include on an MSPE letter. So for instance, he needs to work on differentials. I mean, that's okay. We can be clear that they need to improve, but let's say that in a more respectful, more specific way. You should practice making a broad differential every time there's a new undiagnosed problem, rather than trying to produce the right answer right now. That's a common issue students have. She showed interest in each patient. Well, I hope so, but let's be more specific. She's inquisitive and curious, looking up a patient's problem further in order to learn more, and was also interested in the patient's life journey and personal struggles. Reading that, now I'm like, I like this student. I want a doctor like that. Just saying they're interested, that's kind of what we assume you should have. Not interested in family medicine, but did well on this rotation. This is a comment that does not belong in our MSPE letter or on our evaluation. First of all, it's not very respectful to say, well, regardless of not being interested in my specialty, they did well. But we also really want to avoid saying anything about what students want to do or where they want to live. We don't know if they're going to change their minds. If when they told us they wanted to be a neurosurgeon, then maybe they were just having an especially interesting day. So it's really, we don't want to put into stone some of those comments that they make, trusting us as their mentor to say they're not interested in this specialty, by the way. I know particularly in family medicine, when we're reviewing residency applications, if we see comments like that, that makes us really concerned that this person is not applying to our residency out of a true desire to do this residency, so that will lead them to be ranked more lowly or not ranked at all. Other things we would definitely want to avoid are comments on appearance, even positive comments, which I typically only see for female students, clothing style, fingernails, what field they're interested in, where they're from, or anything that starts with despite being or despite wanting. Please don't do that. Second, we want to write comments that are valuable and actionable. So even if the student needs to improve, choose a growth area. Where do you want to see them go? Where do you want to see them go next? So even if they're doing great, where can they go? And how can they act on that? He didn't seem interested in family medicine. I mean, I'm not sure if that's a fixable problem, and it really crosses the line a little bit. Maybe that student really didn't show a lot of interest. You felt like you were kind of trying to pull it out of them every day to get them to like show any interest in anything. And like, I get it, that happens, but how can we say that in a more actionable way? Work towards being consistently engaged with all patient types and problems. Continue to read more. I see this one all the time. So good student, read more. Really not helpful. I don't know what you're talking about when you say read more. What specifically can that student do to improve? Well, maybe they need to keep looking up relevant studies or learn how to use a search engine with PubMed to look up a particular condition to fill any remaining knowledge gaps. At the level expected of a third-year student. What does that really mean? Does that mean they're really actually a little bit at the beginning of third year? I mean, we should already be reflecting this in our evaluations where we mark, at what level they're at. So in our narrative comments, we don't really want to comment this. This is not very helpful. But maybe we could say the next challenge for her will be to start initiating plans or next steps and practice decision making to prepare for independence in residency. Thirdly, we want to write comments that have been discussed directly with the student. So this is a great tip if you want to ask the student, what are they hoping to improve? So what are your goals? What do you want to work on? And they usually will give you something like, I want to work on writing my notes more thoroughly, or I want to work on knowing the treatment plan that I should go with. And then I kind of take what they say and I put that into their evaluation. I mean, they can't really complain if I'm putting what they actually themselves wanted to work on. I do this a lot for resident evaluations as well. So she expressed a desire to improve in her suturing skills, so we look for opportunities for that. He stated that he wanted to work on expanding his differential diagnosis for undifferentiated problems. I mean, that's kind of almost even better than me saying it, because it's like the student is giving themselves that feedback and you're giving them kudos for that. So those are how to write good comments. Now let's talk about specific words that we use in our narrative comments. So interestingly, you can kind of divide the types of words, adjectives that we use into 4 categories. So the first category is standout words. So exceptional, outstanding, excellent, phenomenal, best. Those are all wonderful words that kind of give an idea of how we feel about the student. But we do need to usually explain why that student was outstanding, what made them stand out to you. The second group of words are ability or agentic words. So these describe more specific skills that the student has or qualities that allow them to complete the work well. So intelligent, ambitious, decisive, competent, assertive, or independent. Communal and compassion words are words that kind of go towards just that compassion and that ability to work with others well. So compassionate, cooperative, team player, empathetic, caring, kind. And finally, grindstone words are words that describe basically synonyms of hardworking. So hardworking, diligent, meticulous, organized. So the student who's kind of on it. There is nothing wrong with any of these words. These are all good words to use and to guide you in writing your narrative comments. So what I want you to notice about these words is if you use them more often in certain types of students than others. So like we talked about, women are more likely to get communal compassion words and men are more likely to get ability or agentic words. So we first of all want to be cautious and make sure that we're not biased in how we use these words and that we use them kind of equally across genders and races in terms of how a student performed. We also want to balance these words. So we don't want to give a student all communal compassion words. You know, we want to kind of, okay, what else did they do that they were good at and try to like refer to those abilities as well. So we want to balance them, and then we also want to include details about why the student had these traits. So they were a team player because they pre-rounded on their patients and reviewed any urgent problems with the upper level resident before rounds began. They presented confidently on family medicine, family-centered rounds. They were assertive when they noticed like an error. I mean, so there's a lot of ways you can take these words and then give an example. So we really want to identify what did the student actually accomplish and not just the effort they put in, but what did they accomplish. So how can we do this better? Well, the biggest tip I have is even though every time I'm with a student, I'm thinking, I'm going to remember this. They did so well today. Wow, they really did a great job with that patient. I don't remember it. I forget it every time. So when it comes to the end of the rotation, I'm like, all I'm left with is that vague positivity. I know the student did really well. I can't remember why. So what has really helped me the most is when I'm working with a student, I have my phone, obviously, and I open up a notes app on my phone that I keep all my evaluation comments, and I'll just kind of take some brief shorthand notes like saw this kind of patient or did a pelvic exam or whatever, so that when I go back to do my evaluation, I can refer to that and I can actually give specific examples. And this has really allowed me to be specific and detailed in a way that I couldn't have been before because my brain just didn't remember any specific examples. The other thing we really want to make sure we do is make sure that our narrative comments support our evaluation scores. Now, I'm not going into how to give evaluation scores during this lecture. We have some other resources for that on YouTube. But if a student gets a 4, which is at an intern level, you really need to reflect that in your comments. So I recently today gave a student a 4 on note writing, and I mentioned specifically in my comments, when this student wrote notes, I did not even have to edit them. And to me, that means they're a 4. Like if I don't even have to go in and fix anything, I just co-sign it, that's a 4. So, so reflect the 4s in your comments, reflect the 2s in your comments. So if a student needed a lot of help coming up with a treatment plan, you might want to put that in there. Now, it could be in the second box, but you do need to reflect something about that too, because assuredly with many 2s, the student's going to come back and question why they got a 2. And I've had some evaluations come back where the preceptor gave them 2s, and then they said they were a great student. And they're like, well, I'm sure they were nice, but give me some more specifics why they got a 2, because the student is appealing it and I don't really have anything in your evaluation that helps me with that. The last other things are just know the expectations of the student in order to evaluate them fairly. So you're going to evaluate a third-year student differently from a fourth-year student. You probably are going to evaluate a third-year student earlier in the year a little differently, but I would expect earlier in the year students would get more 2s and 3s on their evaluation than later in the year, because we would see that growing, right? So kind of knowing what is expected of them. So we can't say the student needs to learn how to use, the EHR, slice and dice or learn how to gather data on the EHR. Like I wouldn't expect that of a student because, it's very difficult if they're learning a new EHR to be able to get into that kind of detail. Or different aspects. I've had some faculty comment like a student didn't know how to use a certain thing on the EHR. And I'm like, I don't think that's really what I'm trying to look for in a medical student. We also want to look at that mid-clerkship feedback. So if we did mid-clerkship feedback with the student, we can look back at that and then we can say, okay, we talked about these things they needed to work on. Did they do that? What kind of things did they grow in this rotation, and put that on there. We also want to consider that these comments are going verbatim into the MSPE. So think about your grammar and your pronouns. Make sure those are correct. Spell the student's name correctly. That would be nice. Don't mention their career plans. Don't mention where they want to live. Don't mention personal things that may have come up in conversation, like, despite being a mom, they came on time every day or something like that. Don't write in all caps. I've had some preceptors who write in all caps, and we have to go back and fix that. We don't want to be yelling on our MSPE. Just make these comments helpful and useful and correct. Think about highlighting their strengths and their areas of development. So think about glow and grow. So what are they doing well, and where are they headed? Where can they grow? We're not really trying to be a judge. We're trying to be a guide. Like, this is what we see. This is where we can see them heading. We're excited about that. I'm not here to be like, you are bad at this. And we can talk about what to do if that's what you really think. We also want to make sure, just give a double check that our comments are not biased towards a specific gender or race, or mention things that you think would, be biased possibly. And thinking about our growth comments, those can be in the top box. So if I really want a student to work towards independence in treatment plans or something like that, we can put that in the top box that goes in the MSPE letter. We want to ensure that any growth comments we put in the top box are not going to be a surprise to the student. So if it's already something you've talked about, like today I put, this student needs to work on chronic disease management and thinking about tertiary prevention strategies. We talked about that. So she already knows that that's what she needs to work on. So she's not going to be surprised when she sees that comment. But if I think a student is really bad at writing notes and I never told them, and then I put it in the top box, that's not very kind. So it shouldn't be a surprise. Should it be a sinker, like you're not going to get matched if I put this comment in here, a big red flag? If you really have those things and you want to say them, they should probably go in the second box. Or if you really can't identify 2 or 3 positive things about this student and you really have severe negative feedback, it should probably already have been addressed earlier in the rotation with the clerkship director, with the College of Medicine, obviously with the student. This should already have been a conversation that you've been having, and the student should have either improved or they shouldn't be passing the course. So obviously if you think a student has failed the course or has really not passed the course, that's a separate discussion. But if you're really struggling to think of anything positive, then that might have been something you should have talked about beforehand. And yes, I've had students where we talked about it through the whole rotation. We had multiple meetings. The student did fail, and I did put all those negative comments in there. All right, we're just going to go through a few examples, and then we'll be done. So this is the first one, and I want you to think about, okay, what are some pitfalls in this, and what are some ways this could be better? So Robert was a great addition to the team. He is enthusiastic and bright and was a hard worker. He's planning a future in general surgery in a rural community and will be wonderful for your residency program. All right, so what do you think about that? It's pretty nice, but I see some pitfalls. So we have some words in here. Team, that's a good compassion word. Enthusiastic, that's a nice word. Bright, hard worker, some grindstone words, some standout words. Not really any agentic language, so we always want to look for that. Did we include some abilities in this? We also see that we talked about his career plans. So how can we make this better? How about this? Robert was an asset to the overall efficiency of the team. He worked very hard to prepare for daily sessions and took extra time to ensure patients with advanced psychosocial needs understood the care plan. He will be one of the strongest residents for whatever program is fortunate enough to recruit him. He is one of the best students I've had the pleasure of working with, and I would entrust the care of my own family to him. So a lot of strong language there, outstanding student, but we did give some actual skills. So improved the efficiency of the team, prepared, took extra time. So there was a lot of integrating those different words, and we took out his career plans. All right, now a negative feedback. Nicholas performed marginally on our rotation, struggling to perform basic functions and lacking foundational professional behaviors. He was dishonest with our coordinator about his whereabouts, and it was not clear if he had even pre-rounded on his patients during his inpatient weeks. Perhaps he should avoid patient care in his residency planning. Okay, big red flags here. Obviously, the person writing this comment is upset about this student, and maybe there were some major issues, So I would argue that if this was really the case, the student shouldn't have passed. So if you really didn't meet or work on any of these things, or the student didn't improve, the student shouldn't have passed. Let's say, these are things that happened and you did work on them. We want to think about how to relay these concerns respectfully without sinking the student's chances of any career in the future. Because with this comment, he's not going to match at all. And that shouldn't be our goal if we are passing the student. So what about this? Nicholas initially struggled with meeting the milestones for Fund of Knowledge and organization on our rotation, but after directed feedback, he responded positively and gave a very strong case presentation and made improvements. Areas for suggested skill building include communication and efficiency. So even if this went into the letter, this is communicating to the residency program that this student did struggle, but that this student did work to improve, and that the student still has improving to do, but just in very specific areas. Last one, Jessica met all the requirements of the family medicine rotation. Her fund of knowledge is at the level expected for her stage of training. She was always on time, and patients seemed to like her. She has a professional demeanor and will make a nice doctor in her choice of specialty. Boring. So I'm like, well, this student sounds kind of boring, but that's sort of a pink flag, right? She's sort of average. She met the requirements. She has expected level of knowledge, and she's professional enough. So we definitely want to give some more specific examples so it can really add to the details of this. I think professional demeanor might be a little bit biased, or thinking about female students, or what does that mean? Nice doctor, I'm not sure what that means either. Met the requirements? Well, we hope so, because otherwise they wouldn't be passing, right? So let's kind of think about what we want to say that's a little more detailed. Jessica met all the requirements of the family medicine rotation, including the evaluation and plan for at least 100 patients. Okay, so that gives us some more detail about your specific rotation. The use of EBM approach to diagnostic testing for at least 10 acutely ill patients, and proficiency in primary care dermatologic procedures. Okay, so now I know more about what your school offers and what she accomplished. Her fund of knowledge is at the level expected for her stage of training at the beginning of her clerkship year, so still kind of kept that in there. She improved the quality of care for our Spanish-speaking patients, and patients continued to ask for her after the rotation had ended. I think you could still add a little bit more, like, does she speak Spanish? Like, what exactly did she do to improve that quality? I like that patients asked for her. I think that's a good nod to her ability to connect with patients. If her fund of knowledge is at the level expected, like, what can she work to grow in? So I think this could be continued to improve a little bit. So I hope that was really helpful for you. If you are part of the Preceptor Improvement Program, watching this video and then completing your next student evaluation will complete your performance improvement project for that. We really appreciate you watching this, and feel free to send us any feedback. Thank you.